Deputy Roisin Shortall.
Thanks, Ceann Corder. Taoiseach, in last Sunday's Sunday Times, you gave an interview and you said there the government will introduce retrospective contact tracing of COVID cases for the first time once daily numbers fall to manageable numbers. And you said that you believe that a robust approach to tracking the infection pathways of each case backwards from the point of diagnosis will help to suppress the virus. Now, it's quite extraordinary that you're only talking about that at this point, 12 months into COVID, and you're talking about tracking down where the virus is being transmitted. I mean, some of us have been asking for that for a very long time. Retrospective tracking and tracing, of course, goes back 14 days. It establishes where the virus was picked up, whether it's come from abroad, whether it took place, the transmission took place in restaurants, or was it in family gatherings or workplaces and so on. It's absolutely essential information for the management of a pandemic. And NEFIT called for that last August. But Taoiseach, I just wonder, who do you think is going to do that work? It's essential work, but who do you think is going to do it? Public health doctors are the people who have the expertise to carry out this work. We should, of course, have a properly resourced public health doctor service. And unfortunately, we don't have that at the moment. Properly resourced public health doctors are an important part of any health service, but in a pandemic, they're absolutely essential. Yet, this service has been starved of funding for many, many years. Public health is the only discipline in our health service that doesn't have the grade of consultant, in spite of having exactly the same qualifications. If the virus numbers are to be brought down and brought under control, then a fully staffed, consultant-led, regional public health team service is absolutely essential. Now, I'm just wondering, Taoiseach, what is the delay in addressing this issue? There have been 3 major reports recommending an upgrading of that service. The Scally report, gone back nearly 3 years, the Crowe-Howarth report in December 2018, and last year's nursing home expert panel made that recommendation. Everybody is saying that it's essential that a properly resourced public health service is put in place. Is it any wonder that doctors won't come back to work in that service here? Is it any wonder that other countries are recruiting our public health doctors? Taoiseach, what are you going to do about this to properly resource that essential service? You've been making promises now for a very long time, and yet no action has been taken. Can you tell us when you're going to do this?
Well, Taoiseach.
First of all, I thank the Deputy for raising the issue, and I would say at the outset that when the pandemic began, testing and tracing capacity within the country was virtually non-existent in terms of the requirements to combat a pandemic, and so it literally was built from scratch. And the Deputy is correct that for quite a number of years there has been a lack of resourcing of public health medicine in general, and you would know that from your own previous time in government as well, and I support what you've just said. And in my view, very rapid progress has been made in developing a testing and tracing capacity, particularly from the summer onwards. So much so that our testing and tracing capacity more generally now is up there as one of the top tier of European Union member states in terms of capacity to test and capacity to trace. And it's a more independent workforce now than it would have been at the start of the pandemic, when a lot of people were redeployed of necessity to engage in testing and tracing. And in relation to public health, the resources have now been provided in the budget, and resourcing has been provided to the Health Service Executive to recruit personnel and to double overall staffing within the public health domain. And I do agree with you in terms of the need for a consultant-led approach to public health, and a consultant-led public health model is a priority of government. Now, there have been ongoing discussions between the Department of Public Expenditure and the Department of Health, and also between involving the unions and the partners. And I would hope that those would be brought to a conclusion quickly, and that the process would conclude in terms of both the consultant issue in particular. And the plan is to double the current workforce in public health, recruiting an additional 255 permanent staff at an annual cost of over 17 million euros. Now, that was included in the 4 billion allocated to health for 2021, 2 billion for COVID and 2 billion non-COVID, which allows for the embedding of a permanent workforce in a number of areas into the future. So it's not just a pandemic era investment in public health, it's for the long haul. So engagement has commenced with the Irish Medical Organisation. There are issues around, whilst doing this, that we do reform the public health model as well in line with Sláinte to Care. A lot of work has been undertaken by the department and by the HSE in terms of a detailed framework for the future public health model that, of course, includes consultant-level roles. And that engagement has begun between the IMO, the department and the HSE, begun back in January. I have asked that this would be brought to a timely conclusion. From a government's perspective, we're committed to doing it.
Taoiseach. Deputy Shortall.
It's disappointing for you to portray this as, engagement has begun in January. This is something that has been recommended for 15 years now. 3 major reports have recommended it. Since, last summer, various government spokespersons have been saying that we're nearly there. We're nearly reaching conclusion. You drove public health doctors to the point of threatening strike action in January because of your failure to respond to this need and to actually take action on it. That strike action was called off at the last minute on the understanding that the government was going to actually deliver on their promises. It still hasn't happened. Now, are you going to force those doctors to the point of strike action again, Taoiseach? How long do they have to wait for action from government? People are fed up with these promises. This is an essential service. It should, of course, be properly resourced. It is critical that it is properly resourced when we're trying to respond adequately to a pandemic. Can you give us now a timescale on when agreement will be reached, when funding will be made available to upgrade those doctors? They have the same qualifications as every other consultant in every other discipline of medicine. Why won't you do it?
Thank you, Deputy.
Let's not have public health doctors going on strike in the midst of a pandemic, Taoiseach.
Thank you.
It would be unforgivable.
Taoiseach.
You're correct that this has been going on for 15 years, you have said, but this is the first government really that has allocated funding, the necessary funding that would be required to action it and to give concrete reality to all of the reports and all of the aspirations. This government has decided to do that. This government has allocated the funding. The issue now is structure, framework and how it's done for the future, and that it's done properly and with a view to making sure that into the future, not only that we have a heavily resourced, but that we have a very well worked out, high quality public health service into the future that's expanded significantly on what we have today. Because yes, the public health doctors right now are working under significant pressures and significant constraints. Of that there is no doubt, and I thank them for the work that they've been doing. There is engagement with the unions and their representatives. That will have to intensify, and from our perspective and from my perspective as Taoiseach, this needs to be brought to a timely conclusion.